Hi everyone! Welcome back to John English Talks. I'm Olivia, and as always, I'm here with John.
Hey everyone, I'm John, and we're super excited to be here with you today.
Today, we have a very useful topic for all English learners. We'll talk about how to speak English at a hospital.
That's right. Hospitals can feel a little scary if your English isn't strong. But don't worry, we're going to make it simple, clear, and even fun to learn.
Before we start, don't forget to hit that subscribe button, give this video a like, and stay tuned because we have lots of practical phrases and examples coming your way.
And remember, you can use everything we teach today in real life. So grab a notebook and let's start.
So John, last week I had a small visit to the hospital myself. Just a routine checkup.
Oh, really? How was it? Did you feel nervous?
Honestly, yes. At first I thought, will I understand the doctor? Will I explain my problem clearly?
That's exactly how many English learners feel. Hospitals are full of words and expressions we don't use every day.
True. Even simple things like telling the nurse your symptoms can be stressful.
And the last thing we want is confusion when it comes to our health. That's why today we'll focus on real conversations you can have in a hospital.
Exactly. Let's start with something simple. When you enter a hospital, the first person you meet is usually the receptionist.
Right. And a common question you might hear is, do you have an appointment?
Or, what is the reason for your visit today?
Let's imagine a short conversation. I'll be the patient and you can be the receptionist.
Okay, I'm ready.
Hi, I have an appointment with Dr. Smith.
Hello, can I have your full name, please?
Sure, it's John Brown.
Thank you, Mr. Brown. Please take a seat. The doctor will see you in 10 minutes.
See? Very simple. But notice the words we used. Appointment, full name, take a seat. These are common and very useful.
Exactly. And if you don't have an appointment, you can say, I'd like to see a doctor. Is there any doctor available?
Perfect. And now let's talk about explaining your symptoms. This is where many learners get stuck.
Yes, it's important to describe clearly. For example, if you have a headache, you can say, I have a headache, or I have pain in my head.
And you can give more details. It started yesterday. It's mild, or it's very strong.
Another tip, use simple words. You don't need to say complicated medical terms. Just explain what you feel.
Absolutely. Let's try a short example. You can be the patient this time.
Okay. Hi, doctor. I have a stomach ache. It started this morning and it's getting worse.
I see. Do you feel nausea or vomiting?
Yes, I feel a little nausea and I vomited once.
Good. That's clear and easy to understand. The doctor can now help you better.
One important thing is asking questions. Sometimes we don't understand what the doctor says.
Yes, you can say, can you please repeat that? Or, can you explain it in simple words?
Or, how should I take this medicine? These are very common phrases in a hospital.
Another useful area is the pharmacy. After visiting a doctor, you may need to go to the pharmacy.
Right. And at the pharmacy, you can ask, can you give me this medicine? Or, how many times should I take this?
Also, don't forget to ask about side effects. Are there any side effects?
Now, let's highlight 5 key words or phrases that will be very helpful in a hospital.
First, appointment, the time you see the doctor. Example, I have an appointment at 3 p.m.
Second, symptom, how your body feels when you are sick. Example, my symptom is a fever.
Third, prescription, a note from the doctor for medicine. Example, the doctor gave me a prescription.
Fourth, nurse, the person who helps the doctor and patients. Example, the nurse took my temperature.
Fifth, emergency, when something is very serious and needs immediate attention. Example, Call the ambulance. It's an emergency.
Practice these words every day, and you will feel more confident at the hospital.
Now, let's quickly summarize everything we discussed today.
First, greet the receptionist and give your details. Use simple, clear sentences.
Second, explain your symptoms using easy words. Give details about time, place, and intensity.
Third, don't be afraid to ask questions. Make sure you understand everything.
Fourth, at the pharmacy, ask clearly about medicine and instructions.
Fifth, remember the key words: appointment, symptom, prescription, nurse, emergency.
And that's it. You can now communicate more confidently in English at a hospital.
Now for our question of the day. Comment below using one of the new words or phrases you learned today. For example, write a sentence with symptom or appointment.
We love reading your comments and helping you practice English.
And remember, practice is the key. Try speaking out loud, use these phrases with friends or family, or even role play at home.
Yes, English improves when you use it regularly. Don't worry about mistakes, just keep speaking.
That's right. You're learning, and every attempt brings you closer to fluency.
Before we go, a quick tip. If you visit a hospital, stay calm, speak slowly, and don't be afraid to ask for clarification.
And always remember, health comes first. Learning English at a hospital is just one step to being more independent and confident.
That's all for today's episode of John English Talks. Thank you so much for listening.
Don't forget to subscribe, like this video, and hit the notification bell.
And stay tuned for our next episode, where we will talk about how to speak English at the airport.
Bye, everyone. Keep practicing and take care of yourselves.
Bye. See you next time, friends.